MART, checking in patients, activating orders, and documenting the patient's pharmacy. This e-learning will demonstrate the process for checking in patients, activating orders, and documenting the patient's pharmacy by patient access representatives within the MART Pavilion. By the conclusion of this e-learning, you will be able to check in a patient for their appointment, activate lab orders, and document the patient's pharmacy. There are several patient access stations at the Cancer Center in the MART. Patient access stations located on the 5th floor include physician visits, hospital clinic visits, and the laboratory. Patient access stations located on the 6th floor include the infusion center and pediatrics. In general, in the MART, patient access representatives are responsible for pre-registration, registration, financial screening, patient arrival, patient check-in, and power orders activation except for infusion. Remember, for infusion patients only, when the patient has an infusion treatment at the infusion center on the 6th floor on the same day as the lab visit, the patient is checked in by the nurse or the unit clerk. The patient's name will appear on the tracking board and in capacity management. Currently, the tracking board is only used for the infusion center. In the infusion center, the nurse or the unit clerk will also check in the lab appointment through EWS and then activate the lab orders through PowerChart. Click the Run Scheduling icon to open EWS to check in the patient for their appointment. It is important to note, only the MLab and the first MART provider visit will be checked in EWS. Click Bookshelf to locate the lab appointment book. The bookshelf now appears. Select Stony Brook Cancer Center. Click the OK button. Select the MART Lab book. Click the Open button. Scroll down to locate the patient's appointment. Select the patient's appointment. Right-click. Select Actions. Select Check-in. Note: ensure the correct encounter is associated with the appointment. Click the OK button. The Available Conversations dialog box now appears. Click the down arrow to select the desired conversation. Note: the Register Patient conversation will always be selected for all encounters with the exception of research encounters. Please note, the Research Pre-Reg registration conversation will only be selected for research encounters. Since this example is not a research encounter, we will select the Register Patient conversation. Click the OK button. The registration was already completed upon arriving the patient. Click the Complete button. Note: the patient is successfully checked in EWS. Next, we will activate the PowerPlan lab orders in PowerChart. Never activate any orders except lab orders. Only after MLab appointments are checked in EWS, the patients can be tracked by using capacity management. You have now completed checking in the patient. Next, you'll proceed to PowerChart to activate PowerPlans, lab orders only. The MLab workflows differ from other workflows because it includes the activation of PowerPlan orders. A PowerPlan order would need to be selected in order to be activated. It is imperative that the correct order is selected. We in Patient Access are only certified to activate lab orders. Activating power orders creates a big risk. The risk is you can choose the wrong order. This could result in preparations of infusion drugs with very significant consequences, which could affect the health of our patients, and also have an extremely large dollar amount loss in the tens and hundreds of thousands of dollars, which could occur only by simply selecting one wrong PowerPlan order. Patient access staff need not be fearful, but must apply caution, focus, and attention to choosing the right order for the right patient at all times. Select the desired patient. Select the PowerChart icon to launch PowerChart. The patient and their lab encounter information appear within PowerChart. Select orders to view and activate the PowerPlan lab orders. No orders appear within the window. To have the lab orders appear, select OP Cancer Center Lab Panels Lab. The Power Plan lab orders now appear. Note: in situations where the lab orders are not found in PowerChart, the nurse must be notified to have the orders written. Check the box next to Power Plan Lab Visit, as this will activate all of the lab orders. Next, we'll click the Activate button. Click the Orders for Signature button. The labs are now activated. The only orders that should be activated are lab orders. It is urgent that careful watch, focus, and attention to detail are taken very seriously when activating orders, at a level even higher than all of the other important work that is completed. When any orders other than lab orders are activated, the nurse, clinician, or provider must be contacted immediately to cancel the orders and then reorder them. This is a very difficult request, as doctors who write orders will need time to rewrite orders for patients they haven't seen since their last visit. Additionally, this may occur during a visit with another patient. If the medicine is ordered, then it must be discarded. These medications are costly. Tens to hundreds of thousands of dollars can be wasted along with the drugs. The most common mistake occurs when staff who activate power orders select the wrong order for the right patient. Therefore, attention to detail is key. Click the Sign button. The message states, "Processing, please refresh." Now we will click the Refresh button. All of the Power Plan lab orders display as active. Below is an example of a chemo power plan. The chemo power plan must never be activated by the patient access staff. The chemo power plans are easily identified by the ONC with the additional information listed with the medication name. Additionally, lab orders, part of the chemo power plan, contains the verbiage Nurse Collect Power Plan. You have now activated the lab orders. Lastly, the patient's pharmacy needs to be obtained and/or verified. This will be completed while you are in the patient's chart through PowerChart. The last step is verifying the patient's pharmacy. Click the Patient Pharmacy button. The city and state fields auto-populate within the Search tab, with the city and state documented in Cerner as the patient's mailing address. Always select the Patient Preferred tab to verify the patient's pharmacy with the patient. When the patient does not have a pharmacy listed or uses a different pharmacy, document the patient's pharmacy using the Search tab. Select the Patient Preferred tab. No pharmacies are currently listed for this patient. Select the Search tab to document the patient's pharmacy. Always ask the patient to verify the city and state in which their pharmacy is located. For this example, the patient states their pharmacy is in New York City. Therefore, Huntington Station must be removed prior to searching for the pharmacy. We will now remove Huntington Station. Enter CVS in the pharmacy name field. Prior to searching for the pharmacy, always ask the patient their pharmacy type and document accordingly. Click the Search button. Always remember to verify the pharmacy address with the patient. Once you have identified the correct pharmacy, right-click. Select Add to Patient Preferred. Click the OK button. You can now direct the patient to the lab. You have now completed the checking in patients, activating orders, and documenting the patient's pharmacy e-learning. Thank you from the Patient Access Department. See you at the next lesson.